Okay. Good morning, everyone. Let me just check and make sure. Okay. Everything should be good. All right. So, I just wanted to do a little slide presentation for y'all because I want y'all to stay on top of your dental trays, which is very, very important. Um, so this morning I'm going to do one on dental composite trays. I put trays on there because it's not the same setup depending on which tooth, what quadrant, what area. So I just wanted to put a lot of different things on here to maybe help all of y'all figure out. So first I want to go in to tell y'all a dental composite is a filling restorative procedure that is tooth colored. So it's a filling that's tooth colored. It matches the shade of the patient's tooth. They can be done on anterior, posterior. So I just wanted to jump on here and do this right quick. So the first thing you're going to do is you're going to clean the room. So you always want to clean the room as if your mom, your dad, your kids, your friends, whoever is going to sit in this chair, you are going to get in this chair. So as long as you always do that, you can never, never go wrong. So you want to make sure to wipe everything down thoroughly. Use your barriers. Make sure the room is like completely sanitized. And the barriers are to just comfort for the patient, just to let them know that you cleaned it, that it's done properly, and that you took the time to cover everything up and, make everything look clean and fresh. The next thing you're going to do is you're going to need air water syringe tips. These are disposable. They do make some that are silver that you can autoclave and reuse again. But most of the time, you're going to use an air water syringe tip that you just take off and throw it away. And you need two of these, one for the assistant side and one for the doctor's side. You want to make sure that you have a new high volume suction, or HVE. HVE stands for high volume evacuator. This is called the bevel, and you're always going to have this end sticking out, and this end is what's going to go into your suction line. Make sure to place barriers over these. So category 2 is seating your patient. When you seat your patient, the first thing you're going to use is your bib and bib clip. You're going to take the bib and the bib clip, and when you're seating your patient, you want that patient to feel comfortable. You want them to feel very welcome and invited. Nobody likes to go to the dentist. Nobody likes to be numb. Nobody likes somebody all up in their personal space. So you always want to keep that interaction going when you seat your patient. You want to always ask them questions. If you can't think of anything to say, use your normal, stuff that you need to be asking them every time. Good morning. What are you coming in for today? That's going to give you the information that you need to make sure that the computer matches the chart, matches the patient's on the same page, everybody knows what's going on. Always keep the patient in the loop, and the patient will help keep you in the loop if you ask the right questions. You want to ask them, has anything changed in your medical history? Have you had any complications with dental work before? Or have you started taking any medications? Anything changed with those? All these things you need to be asking when you're seating your patient. The next thing you're going to do is you're going to make sure you have your topical and your cotton tip applicator, and you're going to place topical on the area that the doctor needs to numb. When you place the topical, this is a great opportunity to check the shade. So you've placed your topical, you want to check the shade of the tooth. You want to do this right now, because if you wait and you start working, you've already cut away some of the tooth becomes dehydrated, especially if you put cotton rolls, which most doctors like to retract with cotton rolls, and it keeps everything dry. You want to make sure to check the shade before the doctor starts working. This will help you to go ahead and get your composite shade correct. You don't want any dehydration, because if the If you leave your mouth open and you place cotton rolls and all of this, the tooth becomes dehydrated and the shade will not match. Well, I don't want a composite that doesn't match. That's the whole point of a composite, is for your shades to match and nobody can tell that you had it. So make sure to check your shade, very important. The next thing you're going to do is you're going to open up your doctor's pack. Inside the doctor's pack is going to be your mouth mirror, your Explorer, and your cotton forceps. You're going to open this in front of the patient because it just gives the patient peace of mind knowing that the instruments are clean. And that's very important. Your patient is your main focus as being a good dental assistant. The next focus, of course, is the doctor, but the main concern is your patient. The mouth mirror is going to be used to retract so the doctor can see what he's doing. You want to keep it very clean and very visible. And sometimes you might need to use your air water syringe to blow air on the mirror so the doctor can see. The Explorer is going to be used to sometimes spread flowable around. It can be used to check for any cracks, crevices, decay, those kind of things. So the doctor is exploring for something that's wrong. Cotton forceps are used to remove things from the patient's mouth and put things in the mouth, such as a cotton roll or gauze or your wooden wedges. The next thing you want to have ready for when the doctor comes in is your anesthetic syringe, because you have to numb the patient before you can start working. So you're going to have your anesthetic syringe ready. Your anesthetic carpules of choice by the dentist, depends on what area, what tooth he's numbing. And you want to get your needle ready. You want to have all this out of sight of the patient. They have two different sizes. You have your blue and you have your yellow. Blue is mostly used for maxillary, and your yellow is used for mostly mandibular. Category 3, prepping the tooth. I set this up, prepping the tooth is getting the tooth ready to do the restoration. So the very first thing we're going to do is high-speed handpiece. The doctor is going to use a 557 burr, or he can use a 330 pair if it's a smaller filling. You're going to have your straight handpiece and motor ready. Oh, let me back up. Your high-speed handpiece is used to open up the tooth so you can get to the decay better. Your straight handpiece and your motor, you're just going to have them ready. You're not going to use them yet, but you want to put them in the category of your handpieces. You're going to have your low-speed handpiece ready after the doctor has opened up the tooth. You're going to use your slow-speed handpiece with a round burr. That is to remove decay, and the sizes of your round burrs are 2, 4, 6, and 8. 2 being the smallest, 8 being the largest, depending on the size of the cavity. You always have to have a motor in order for this to work. You want to make sure to have your restorative burr block. This gives you all the different types of burrs to prep the tooth, adjust the tooth, all those kind of things. So you want to make sure to have your restorative burr block ready for your doctor. Once the doctor has removed all the decay he can, if and only if it is close to the nerve, the doctor is going to use the spoon excavator to scoop out any additional decay that's in the bottom, because he can't see inside the tooth, so he's not going to use a handpiece. He's going to use his spoon excavator to scoop out any more, because he can feel that there's decay still in there, and he doesn't want to expose the nerve. If he gets too close to the nerve, the doctor is then going to place DiCal on a DiCal instrument at this time, which you will mix 2 little dots, one with your base and one your catless. You're going to mix these 2 together on a mixing pad and use your DiCal instrument or ball burnisher to place the DiCal inside the floor of the prep. Let me back up. This protects the nerve. So if you have a cavity that is very, very close to the nerve, this is going to protect the nerve and kind of calm it down medicated basin liner. All right, category 4, restoring the tooth. Restoring the tooth means putting it back the way it was, making it look good. You're going to need your wooden wedges. If it's an interproximal, you could use a clear matrix band. Most of the time this is used for anterior, but you can use them for posterior too. Depends on the doctor. So you just stick it interproximal between the teeth, and then you put a wedge, and that's going to hold it in place. It's clear so that the curing light will shine through it. Some doctors like the Tafelmeier and the Tafelmeier band. This is your Tafelmeier. This is your Tafelmeier band. And they use those on posterior teeth. And this shows you a wedge, and it shows the doctor checking decay. And sometimes they'll even go in and rub the inside of this to make their contact a little tighter. So a Tafelmeier band is used on a posterior tooth. This is your mesial, and this is the wall of the tooth is gone, so it's open. So you want to build back that contact. So this, the band, is going to separate the teeth so that you don't bond them together. Another system that they use is a matrix system. So all of this is matrix because it's going around the tooth and putting it back, but this is just a different system. This has your band is right here, which shows in the picture, and this is your ring, and there's your wedge. These are your wedges, this is your ring, and these are 2 forceps that are used to place the ring, the wedge, and the band interproximal between the tooth. So just wanted y'all to see this. All right, so once the tooth is prepped and ready to go, the doctor is now ready to fill the tooth. So we're going to take the acid etch, and it comes with a disposable tip you put on it. He's gonna squirt it into the tooth and rub it around with a bender brush. Once this is done, the doctor's going to rinse and dry. You have to make sure that the tooth stays dry. At this point, you might want to take the cotton rolls out and put new cotton rolls in. The next step is, once the tooth is dried, you're going to apply the bond. This is a bond, and it's going to be applied with a micro brush, and you're going to put it in a bonding well. This has an orange slide on it, so you slide it back and forth. Some of them, they don't all look the same. You're going to use this to protect the bond, and it can stay in the well and it won't dry out. So once you put the bond in the bonding well, you can slide it open and the doctor can get it and apply it to the tooth. Once you apply the bond, you're going to blow it thin with some air from your air water syringe tip, and you're going to light cure it. Once the tooth is light cured, sometimes, not always, but most of the time on posterior teeth, the doctor will use flowable and spread it around with his Explorer, which comes with a new tip every time. And then once that's done, you're going to light cure. Then you're going to use different types of composite. So they come in all different shades. And this one is a composite carpule, which are here, and it's dispensed with a composite gun, which is here. So this snaps into there, and it squirts into the tooth when you squeeze the trigger. These are unidoses, so they can be thrown away and disposed of after each use. Another kind of composite is a packable composite, and it comes in a syringe. You're going to twist the end just a little, and then the composite will come out the end. You want to make sure to keep this covered because you don't want it to dry out. So once that's done, the doctor is going to use a composite instrument to place this into the tooth. When he does this, he's going to either use some bond, or he's going to use an alcohol wipe on a 2x2 gauze. Put some alcohol on a 2x2 gauze. And you're going to wipe the ends of this off to keep it wet so that the composite doesn't stick. Then, of course, as he packs it in, you're going to light cure. Once all this is packed in place, you're going to do a final light cure to set everything up. And now we're ready to finish and polish. The first thing you're going to do is, once you get to the finish and polish stage, is you're going to use your articulating forceps and paper. You're going to take the paper and you're going to insert it here by pushing these together. When you squeeze, it's going to open up the end and you're going to insert your paper. You want the paper to stick out over here where it looks like a flag. You then insert that into the patient's mouth and they bite on it. Bite down, tap, tap, grind around. It's going to show marks. You're only worried about the part that you filled, not the other teeth at this point. If it marks on the filling that you did, you know that it is high or it needs to be adjusted. So the doctor will adjust it down to where every tooth gets a mark on it. So it's called articulating. To polish and smooth off those rough edges, you're going to use the disc and the mandrel. These are discs and they come in different grits, and this is your mandrel. These discs snap onto the mandrel here, and it is inserted into your low-speed handpiece. If it's an interproximal filling, especially on some anteriors, we're going to use a finishing strip. These come in all different kinds. I showed a picture here of just the different colors so it can show you different grits. These are like sandpaper, same thing. These are used for interproximal fillings on the mesial or distal where they meet together, for us to clean them up so there's no overhangs and just make sure everything is clean and smooth and that the patient can clean their teeth properly when we're finished. You always want to double check behind yourself with a sickle scaler, and this will check to make sure we don't have any overhangs. You're going to make sure to floss so that there's not any like overflow of bond or any composite that got interproximal. And we are done. All right.